A while back, Sean King had a chance to interview Dr. Charles Mabray for our segment, The Doctor Is In. Let's take a look.
Dr. Charles Mabray has been a practicing OBGYN for nearly 40 years, but he's also a certified bariatric physician, helping women to achieve and maintain a healthy weight. He's the kind of doctor we all wish we could have. And not surprisingly, he has over 200 patients on Max. Tell me about your own personal experience with Max.
It has changed my life, understanding that we have a product that actually works,
Yes.
that makes a difference in the body, that
Absolutely.
makes a difference in lifestyle. And I was introduced to it and as a means of accelerating glutathione in the body. And I had been looking for glutathione, some way to improve glutathione in patients that came to see me for many years. And so this captivated my attention. We actually offered some samples to a few people to start with fantastic results, and I was hooked. And that's what excites me about MaxGXL, is that it is making the choice to improve one's own health and to take responsibility for our own well-being, and particularly in today's world when we see all kinds of pressures and problems addressing healthcare. To be responsible for our own health is exciting, and to have a tool that really makes it happen is even more exciting.
And you must see so many things that come through the pike that claim to make a difference, but don't.
You know, it has been many, many years that I have been a believer that we need to fill in the holes of our food chain for all kinds of reasons. We get produce grown on worn-out land, chemical fertilizing, insecticides and pesticides. Our food chain is different than it has been historically, and so I've looked to supplements to improve those kinds of factors for many, many years. But I've never seen a supplement that made so much difference in so many people so quickly as did MaxGXL.
Do you have a particular favorite story about one of your patients?
Well, probably my favorite story is that when I first started using it, I got a sample from my sponsor and went to my office staff and divided the sample among my office staff because I wanted to see if they were going to live through it all or not. And in fact, not only did they live through it, but within 1 week, each one of them had a story to tell me that was just astounding to me. They had that 100% response.
Wow.
In a week, and I had never seen or heard of anything that would do that. That did spoil me, though, because I expected everybody else to respond absolutely perfectly, and that's not the case. Scientifically and at the cellular level, I think the response is there, but not everybody knows that they have found a new life.
Right. Max can't help but change a life.
Yes. As a matter of fact, I often tell my patients that if I still had a dog, and I'm a dog lover, I don't happen to have one at the moment, but if I had a dog, I would give my dog MaxGXL.
Oh my gosh, okay, Biscuit, here we go. You're getting your Max.
That's right.
That's our dog. Oh, that's great.
Absolutely.
Tell me about your business and how that's changed because of Max.
Our objective is always to find things that will actually make a difference, that people can begin and take and do that would lead to greater health and protection. As you mentioned earlier, I'm also in bariatric medicine, and one of the characteristics of fat cells is that they are major producers of inflammatory products.
Sure.
And so when we can do things that impact both nutrition, weight, and add the MaxGXL, we've really got a 1-2 punch that works.
Absolutely.
It's exciting.
Wonderful. Now, I've heard that you and members of your staff have become Max Associates. Is that true?
Absolutely.
Wow.
Well, for 2 reasons. Number one is that the staff got to see all of the results and the successes and say, wow, let me in on this. And of course, remember I tried, they were my guinea pigs to start with, so they knew that not only did it work in others, but it worked for them. And that made them excited to be part of the program. But also, our approach at our office is that even though I'm the physician, everybody plays a part from the time they walk, well, even before they walk in the door. When they call to make an appointment, it makes a difference who answers the phone. and how they're appreciated or not appreciated from the moment that they have contact with the people in the front, our nurses. All of these folks are important to me. They make my practice run. And so we gave everybody the opportunity to become involved with Max. And I think they are happy that they have continued to be Max associates and playing a part in helping people feel better, get better, live better.
That's great. Thank you so much, Dr. Mabray.
It's a delight to be here. Thank you.
Very nice to have you here.
We're excited about it. Thank you.
Okay.
Okay, bye-bye.
Bye.